You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, board-certified oral surgeon, Dr. Zarrinkelk. Dr. Zarrinkelk, welcome to the program.
Thank you for having me, Randy.
Now, for people that don't know you, who's the typical patient that's coming in for dental implants?
The typical patient that comes into our practice for dental implants could be a teenager that's missing teeth, or it could be an elderly gentleman that's has been wearing dentures for many years, or it could be somebody who's has a terminal dentition, somebody who's about to lose their teeth.
Now, we're talking about dental implants today. You're one of the guys that trains doctors from all over the country, right? All over the world, I think you said, on the procedure of dental implants for the denture wear. Tell me about that. Is that right?
I am. I'm fortunate enough to be asked to participate in teaching, and I'm actually pretty passionate about that because I think that more dentists and more surgeons should be trained in treatment, in more efficient treatment of these patients, so it's more accessible to more folks that really need them.
So you teach like a minimally invasive dental implant procedure. You say it is graftless. What does that mean?
Basically, we are avoiding any kind of grafting procedure before placement of implants.
Like bone grafting?
Like bone grafting. What traditionally has been done, if you are a dentulous and have been wearing dentures for many years, you typically lose a lot of the bone support for the denture. So when time comes to place implants, or you're considering doing implants, there is really no bone to place the implants in. So in the old days, well, not too old days.
Old days, it's still being done today. It's still being done today, right?
The more traditional, let's just put it
because you're
that
trying
way.
to be,
right.
kind, right? To
well,
because dentists start doing it. The public needs to know. I think it's a fair question that not all doctors are doing it the same way.
And that doesn't mean
some are doing it more invasive. They may be getting great results, but you're teaching a less invasive way.
We want to make this more affordable, more available to more patients. That's the bottom line.
You said to me that they can walk in without teeth on the day of the procedure and walk out with teeth that they can eat on and chew with. Is that right?
That's absolutely true. We almost guarantee patients that would be walking out without teeth.
What do you call it? Like teeth in a day or same day dental implants? Is there a name for it?
We don't really like to call a name. My emphasis is to provide a graftless and provide a quick, efficient way for a patient to walk out with a set of fixed teeth.
And people need to know this is a real interview.
Right.
And I'm just asking the question. I'm not trying to endorse you, but you are an oral surgeon, right? And people always, they reach out to us on the Wellness Hour. They say, and they ask for a referral, and we're not a referral site. But I do say go to a specialist when you can. Go to somebody that this is all they do. What are your thoughts on that? That means if you're going to get dental implants, who should you go to?
Well, you know that I'm involved in teaching a bit, and that is a very common question I get asked by the students is, should I be doing these things? And I have stopped. It is not my position to tell somebody what they should and what they shouldn't do. But I think if you can get the training, you need to have the training before you can do some of these more advanced techniques. But I think to put it in a perspective is that if you have a broken leg, would you go to your primary care doctor to have your leg fixed?
I guess not.
You guess not. Why would you do otherwise for your teeth? Why would you do otherwise if you need extensive, complicated procedures?
So go to a specialist. Does it cost more to go to a specialist?
No, it shouldn't. It shouldn't cost.
Okay,
we
good.
buy the implants from the same company, and we do the procedures the same. So the cost should not be different.
You say that you're changing people's lives, transforming their lives. How so?
Well, I can tell you that in my career, these patients that I treat with dental implants, especially the dentulous and people that have terminal dentition or about to lose their teeth, most of these people come to me just fearful of wearing a denture and fearful of what is in store for them. And this is probably the most rewarding part of my practice, of my entire career, is treating these patients that you see right here. And to see that they come in with a essentially non-functioning, unaesthetic look of a dentition, and they walk out with a beautiful looking smile that they can go out and function and be with their family and go to their weddings or whatever they have planned. And typically these patients come in to have something done because they have something planned to do. And whatever it does for their life, and it's different for every patient.
When we say at the top of the show, no more dentures, do you believe that? That means the future of dentistry is the way dentures are today, they'll always be attached to something?
That's the way it should be. That is really a passion that I have, is that nobody should be going to bed with their teeth in a glass jar next to their bed.
So are there a lot of people wearing dentures? Like, let's say you're in Ventura, but in Santa Barbara, LA County, are there estimates?
Well, there's two answers to that. The World Health Organization estimates that there's 240 million people wearing dentures in the world. There is a lot of patients that wear dentures, and you have to just look around you. I mean, I'm sure some of you relatives have worn dentures, and I know for my family, both my grandparents wore dentures, and it's really sad.
If it's so good, giving somebody dental implants to give them a fixed set of teeth in their mouth or something that snaps in, snaps out, why aren't they all doing it? What's your take?
Most patients that are wearing dentures don't visit the dentist. So to them, to the dentist, the treatment is complete, and if the dentist doesn't recommend an option, then the patient wouldn't know. So if you don't go to your dentist and you have a denture, you assume that you're completed. Let me tell you the life story of a denture wearer. These patients all had teeth many years ago, and they had to go to dentists many appointments, and they've had to have root canals and tooth removals and bone grafts and gum grafts. So a lot of times these patients are skeptical in dentistry altogether, and they're just tired of going to the dentist.
So the last thing they wanted to go
The last thing they want to go is to go see an oral surgeon, particularly.
Yeah, nobody likes to go to the dentist, and nobody wants to go to the oral surgeon.
Because
right? Do you hear that?
Oh, I mean, that's the story of my life.
What do they say? What do they say to you?
You know, another misconception with dental implants, which ties into this, is that they feel that, or they think that it's going to be painful.
It does seem painful.
It seems painful. And as soon as you walk into an oral surgeon's office, you associate that with pain, which is not anywhere near the truth. I mean, it's farthest from the truth. So pain is not a factor.
What do patients say?
Most patients, I always tell patients, prospective patients, that 99%, obviously I haven't had a full mouth of implants, but I've had many patients that have had this done, and 99% of patients say that it was a lot less painful than they thought. Most of them say that they had virtually no pain, which is really remarkable if you think about it. They always say that it was more painful when I had my teeth taken out many years ago, but boy, this was a lot simpler than I thought it would be. So I tell my patients that pain is really not a factor, just like age is not a factor, because that's...
Yeah, how old can you be to do this?
Well, there is really no age limit, and as you know, as our population is getting older and more older, we have to deal with more older people. But implant dentistry does not really have an age limit.
So are you saying that there's not really a happy denture wearer? Like, I know a couple of denture wearers. They never complain.
Very interesting that you brought that up, because there's actually a recent survey that came out of denture wearers in the U.S. that showed that only 5% of denture wearers are happy with their dentures. What's more interesting is that 73% of them said that if their dentist had brought up options, they would have considered it. So again, we'll go back to the lack of education, lack of training at dentists and public, is that our dental friends, our dentist friends, are not recommending the appropriate or what's available out there for these patients.
And I think we talked on the telephone. You said if there was a test drive, because there's so many people wearing dentures, right? That if they could come in and just try some dental implants and a fixed set of teeth over the weekend, just like a test drive, that nobody could go back to their denture. You believe that?
Nobody does. I mean, nobody would. And every single patient that we've done this treatment for, every single one has said this is the best thing that I've ever done for myself. And that's a very powerful statement, because every single one, to say that this is the best thing I've ever done for myself, that is, I've never had a regretful patient. That's just, I've had other procedures that patients regretted, but this procedure, nobody's ever regretted it. Again, because you and I can't really relate to them. Once you start missing your teeth, and once you start not being able to eat and function and be with friends and smile in public, then you really realize what they mean to you. Like they say, you don't know what you have until you lose it. So
insurance, Medicare, does not cover dental implants here in the United States. You have financing available.
Right.
Is that right?
That is correct. We, again, because of our graftless approach to this procedure, we do minimize the costs. These are all procedures that are in the office. And so we make it a lot more affordable. It costs roughly 50% of what it was costing a few years ago. So there's been a significant drop in the cost of this procedure. And we have financing, and we utilize their insurance, whatever they have. So we work with patients to get them what they want.
So when a patient goes into your office and they're wearing false teeth,
right,
what do you propose to them?
Well, we give them all the options, and have a few options, which is a good thing. The number one option would be the simplest option, would be to just place 2 implants and give them a snap-in denture. It doesn't have a bar, it just has 2 little ball and clasps that attach to the denture and the implants, and it gives them a little bit of support. It makes it so the denture doesn't rock around as much as they used to, and it's better than any denture they've had in the past. So that really improves it quite a bit right there. The next option, which gives them a lot more support in chewing, so now they get vertical support as well as the dislodgement of the denture essentially, is to place 4 implants and have a bar placed on it. So this is, you got 4 implants, you got a bar that goes all the way across, and the denture actually clasps onto that bar. So now when you chew down, you're not going to have as much movement, you're not going to have pressure on the denture, your gums as much, and also you don't have the dislodgement as your tongue moves around it. But if you've had 4 implants placed in our practice, why would you want a removable denture when you can have a set of teeth that doesn't come out? So you don't take it out at night anymore and put it in the glass jar next to
And
your
what about
bed.
the upper? Upper, is it necessary? Because there's a suction of the upper, right?
Right, there is a suction of the upper, but that is actually a problem with the denture. Now your palate is covered up and you're not going to be able to taste your food as well. So you have a lot of plastic in your mouth. So the recommended treatment for the denture on the upper jaw is to place 4 implants. The 2 implant system doesn't work in the upper jaw, so you need a minimum of 4 implants. So again, if you're getting 4 implants placed, why would you have a removable denture? It's just it costs roughly the same too, to just get a fixed appliance.
So a fixed set of teeth.
A fixed set of teeth. We hardly ever do removable dentures or that sort of appliance anymore.
But isn't it true that if you are in dentures like 30 years plus,
right,
that you don't qualify for this, or
right,
you've lost too much bone?
The reality is that that's not true. You do have the bone, and with the new techniques that we have and the new imaging techniques that we have, we can find areas of bone that you have that in the past were not being able to utilize. So that's not true. We can treat virtually anybody without any kind of bone augmentation and the other procedures that are recommended.
What if you have a little bit of osteoporosis?
Not a factor.
Is that right?
Not a factor.
So just about everybody's a candidate?
Just about everybody's a candidate. There are modifications to the treatment you have to do. But if you look at the cross-section of the patients that we treat in our office, the average patient is 65 to 70 years old. The average person is a female. And our success rate on those patients is the same as the 45-year-old male. You do have to modify the techniques a bit, but osteoporosis, and there's plenty of research on this, does not affect the dental implant.
You say 90-year-olds are doing this.
Yes.
Are the implants more likely to fall out with age? I mean, if you're older, it's riskier?
No, that's not risky at all. The only thing that age does is brings in other health-related issues, the other factors that you have to consider. As far as the bone, as far as the longevity of the implants, that is not an issue.
Okay, so let me get this straight.
Sure.
The way it's normally done, there's a lot of bone grafting
Right.
in dental implants.
Right.
You teach to dentists all over the country
Right.
and out of the country this bone graftless procedure.
Exactly.
So you rarely do bone grafting.
I never do bone grafting.
You never do bone grafting.
We haven't done a bone grafting procedure for a denture wear patient for 5 years.
But when I talk to a doctor, I was talking to a dentist, by the way,
Right.
because you told me that.
Right.
He said, Randy, I don't know, some people just need some bone grafting.
If there is, I haven't seen them.
Now, you brought some other photos. What are we
Sure.
looking at?
Well, let's look at this young lady here. This is a classic patient.
Wow.
This is a classic case of somebody's neglected their teeth, and now they've had a rough time in their life, and now they're ready to get back into the job market. And if you look at that smile and you're trying to get a job, you can imagine what the difficulties would be.
That has to be very unusual.
And that is not an unusual, but don't forget, we talked about this before, these people don't smile. So there's a lot of people that have teeth like that, but you don't know about it. And they're in pain and they can't smile, and this is a classic case of that. And this is a patient that presented to us like that and was having a difficult time finding job and functioning and so forth. And they had decayed teeth and infected teeth, and so she had health issues related to this. And we were able to successfully treat her. And look,
So
at
those
this
teeth
smile.
had to come out,
Those teeth had to come out.
and then you give her what?
We gave her what we talked about, the all-on-4 procedure. The teeth were removed, and on the same day, the implants were placed, and she walked out of that office with that smile.
Wow.
And then when you look at that extreme makeover, if you want to call
Yes.
it. I mean, again, don't look at her smile, look at her eye. Look at the transformation of this person, this individual. And so when I say this is probably the most gratifying thing I ever did in my career so far, it's just evident right there when you look at the
So
patient.
you use the term all on four. That's
Right.
4 implants with a full arch of teeth that don't come in and out. Just
Exactly.
like a fixed set of teeth.
Exactly.
So she can eat, once she's healed up, she can eat whatever she wants?
And she is healed up. This is a few years ago, and she can eat whatever she wants. She eats everything that you and I eat.
Do you tell them, like, be careful with carrots, like raw carrots? Or
Even after the complete healing
Yeah.
period? No. There is no restrictions of what they can eat.
is this just as strong as when they were 18 years old? Maybe
Well,
even better?
I like to tell them that it's actually stronger than their own teeth. And the fact is that they can function and eat whatever they want, just like their 18-year-old teeth. So
So they forget about them.
they forget about them. I mean, to these patients, those teeth are as natural and as part of them as their natural teeth were.
It's a cosmetic result, by the way. They look like veneers. Are they veneers?
No, those are actual denture teeth.
Okay.
Those are actually denture teeth, and we can have different options as far as the teeth. So the final result is where you really need artists making it. And if you look at her case, you can see what a beautiful smile she has. She has the teeth going back and the contours of the teeth, and the shape of the smile is perfect for her face. And that's where you need a special team and somebody who really knows how to set up the teeth. Because for me as a surgeon, I've done the anchors or the implants, but it's the teeth that's really important. And I think in her case it came
I mean,
out.
she could have ended up in a denture. Is that right? Is that where most of these people end up?
Most of these patients end up in the denture because the alternatives are so cost prohibitive for most people, so that they end up having to remove the teeth and wear dentures. And I would say that almost all the patients that I see in my practice have seen other folks, other clinicians, other dentists, and they were offered other options or grafting options, which are painful, costly, time-consuming.
Bone grafting we're talking
bone grafting and things of that
You don't
nature.
like bone grafting.
You know what? I trained with the father of bone grafting oral surgery, and I am completely the opposite now because for these class of patients, bone grafting is not necessary.
So they save money because bone grafting can be expensive. Is that right?
A lot of money. Yes, it is expensive.
So you've eliminated the bone grafting part in
Completely
your
eliminated.
practice.
Completely.
And you're teaching other doctors.
We teach
How
it
often do you
routinely.
lecture on this to other doctors?
Well,
personally?
we have a program that we perform live surgery.
That's right, you're a training center.
We actually have a
Forgot
training
about
center.
that.
Yes, that's right. We were, again, fortunate to be asked by the largest implant manufacturer company to teach other oral surgeons and dentists how to do these procedures.
So it really is no more dentures
Not in our practice.
in your hands.
No.
So nobody should be wearing dentures in your opinion?
Nobody should be wearing dentures, in my opinion, and I can tell you that in our practice, nobody walks out with removable teeth anymore.
Well, good for you.
Thank you.
We have time for a few more photos.
Sure.
You brought these photos.
This is another very interesting case, a very good case. This nice lady came to us because she had been wearing dentures for many, many years, and she was doing fine with them. And she was doing fine with them until her husband passed, and then she had to find something else to do, find some entertainment, but going out with friends and things of that nature. And in the past, she used to take her teeth out when she was eating, but now when she was out with friends, she couldn't do it. So she became a social recluse. She was not going out, and she actually came to my office with tears in her eyes and saying that I've been seeing a really good dentist, and she had, and I've been told that nothing can be done for me for many, many years. And is there anything you can do? And
How did she hear about you?
well, she found us through an article that was done about the procedure we do at our local newspaper.
Okay.
We had helped a couple of other patients, and they had highlighted in an article, and she came through that, and we talked to her. And this is a patient, again, that had gone to universities, and they had offered her, again, the same traditional approach, and she decided not to.
Traditional approach meaning
Of
it
the
could not
bone
be done, or bone grafting?
Bone grafting, and long time without her teeth while the bone grafts were healing. And she came to us, and we were able to treat her again with the more advanced techniques, which is called the zygoma implants. These are implants that engage the patient's existing bone again. This is what I was talking about, that she didn't have any bone, but she had bones in areas that in the past were not accessible.
So that's what that is right there. But that's a nice smile now.
That's a beautiful smile. And this is, again, look at her eyes. You know, this is a patient that
Yeah.
came in with tears in her eyes, could not function anymore on a social level. And now, a few weeks later, she's out, she's with her friends, she's eating normal food, she has a beautiful smile. And I guess, you know, again, I have to give credit to the dentist that created those teeth, but it makes me really look good because I'm the one that did the surgery, but the dentist that made the teeth should really get some credit for it, because I think she has a beautiful smile for her age.
It's very
nice. You can see in the before picture how her smile was closed up. She had lines around her lips. Now she's got a big smile. But then again, the big thing, just look at her eyes, and I think you can see the difference. One more thing I want to add about this patient is that these two last patients really, these are patients that I treated a few years ago in the beginning of when I transitioned to this graftless approach. And these two patients are really the reason that I've dedicated my entire practice primarily to this kind of treatment for these patients. Because of how thrilled they are, because how we changed their lives. I mean, there's nothing else I do in my profession that has this kind of an effect on somebody.
I think you said they want to give you a hug sometimes.
They all do. I mean, these patients all are really transformed, and they become part of our family really in our practice.
You say some people, by the way, even though they can eat and chew and all that, I think you said they don't even care if the teeth work.
That's true.
What do you mean by that?
What my experiences with patients is that what they really want is they want good-looking teeth. And on the secondary, they want it to function well and not hurt and things like that. But what they primarily want is they want to look good. And that's what we should be doing, is we should be giving these patients what they really want. I think sometimes dentists get mired in techniques and material and things like that, but that's not what we're really all about. We're about to give the patient what they want, and to have them say yes to us, but the treatment that we can perform for them.
Very nice. And I know you have two more patients you wanted to show. We have time for just a couple of them.
I just brought this picture because I thought it was interesting. This is a patient that came to us from Hawaii, actually. He had heard about our facilities, and he came in, and then he went back to Hawaii the day after surgery, and I told him that, why don't you send me a picture of what you look like? And this is a picture about 3 or 4 days after double zygomas. These are, again, those long implants that engage the cheekbone. And you can see that he's on the beach 3 days after surgery.
So he would have had a denture, and now he has a full arch of teeth that don't come in and out.
Well, actually, he came in with a denture. He came with an uncomfortable, unaesthetic, not good-looking set of dentures, and he went back to Hawaii with a set of teeth that don't come out, and he can eat whatever he wants on.
What about pain for this guy? Because it does seem painful. You say it's not very...
Look at his face. Does he look like he's in pain?
All right.
These patients have virtually no pain. And I know that's hard to believe.
So don't let pain keep you from doing this.
Don't let pain keep you from doing this.
All right. What else do we have here?
Oh, let's look at this case. This is a very prominent individual who was...
Oh, my goodness.
Who had some bad experiences with dentists in the past and had really let her mouth go because she just could not stand going to the dental office for many, many years. And I guess she was in a position where she had to have a good smile. So those teeth had to go. It was either a denture, and this lady was not going to wear a denture because she's in her position at her job, there was just no way that she was going to be able to function with a denture. So she came in, we removed all their teeth and placed the implants for her, and she walked out with that smile. And that is absolutely...
Very nice smile, actually.
That's right. And that is actually a week after surgery. So I brought this case to illustrate that this is what you look like just a week later. There's no bruising, there's no discoloration, she is comfortable. And look at her eyes again, and look at her smile. I mean, she's thrilled.
Yeah, she does look thrilled.
This is a person that's not been able to function. She has hardly any teeth to chew on. Whatever teeth she has hurt when she chews on it. They're infected, they're decayed. And the next day, she has that smile. I mean, I think that's just remarkable. And if we go back to the traditional way of doing this, that's what's really remarkable, is that how we've gone, how much we've learned that we can treat these patients so much more efficiently, so much more cost effectively, so much more simpler for them. And that's the key, is the simplicity of this procedure is really the key. And we have another good example here. This is a very successful businessman in our community. He has endured this smile and this non-functioning teeth essentially for many years.
Wow.
And now he's at a stage with his life where he wants to do something about it. I mean, look at that smile. I mean, we've asked him to smile really as big as he can, and this is the best smile he can give us.
It's like a grimace.
It's like a grimace. And then you compare that to the reveal or the after procedure, and you can see the difference. Again, like I said before, don't look at their smile, look at their eyes, and you really see what the transformation has been. So the options for this patient was what? It would either be dentures again, or what we performed for her. And I think that at least for him, the difference was huge. I mean,
so fixed set of teeth. Everybody we're talking about, like you say in your office.
Right.
These are not just snap in, snap out. This is a fixed set of teeth that don't come in and out.
They're just like your own teeth. They're
You can
just
eat
like
whatever
the
you
teeth you
want.
had when you were 20 years old. You can eat whatever you want. They function, look, and act just like your own natural teeth.
Now, the Wellness Hour. We
Yes.
air all over the U.S., all over
Sure.
Canada. We have a lot of medical doctors. We have a lot of dentists. Some guys like just doing the snap in, snap out. Some dentists.
Right.
And I said, well, what about fixed? Because to me, logically, it seems everybody would want fixed, a fixed set of teeth.
Right.
Is it because they don't have the training? I mean, what's your take? They don't get it? Just your opinion.
I think a lot of that is fear. I think that a lot of that is fear on the dentist's part of getting involved in a more complicated procedure because they're used to that simpler snap in, snap out. That's simple to do for them. And now we're talking something that's technically potentially a little bit more outside their comfort zone. And that's the biggest hurdle that we have, is that getting these dentists to step outside their comfort zone and offer their patients what are the options that are available to their patients.
Somebody watching this, though, maybe they're wearing dentures, right?
Right.
Or their teeth have to go.
Right.
Final message to them. Maybe they're still skeptical. They think they're too old or whatever.
I say to them that you're not alone. And there are a lot of folks like you out there. And we've helped a lot of folks like you. And so come on in. Just come in, let us look at you, let us get the radiographs that we need, and we'll give you the options that are available to you. I think that's the biggest thing. So you at least walk out knowing what could be done. And then you decide what you want to do.
And if everything works out right, somebody in their like 70s, they're wearing a denture. If the healing and everything goes right, what's the fastest turnaround? How fast can they get their fixed set of teeth?
First of all, it's never if it works out. It always does work out. We have a 100% success rate on this procedure. Not a single patient has walked out of our office without a set of fixed teeth. Secondly, how fast it could be done, as fast as you like it to be. And we have patients come in from outside of our area, and those patients are seen the next day, and it's done very quickly. So,
but making the teeth and everything, like a 2-week turnaround?
No. 2 weeks? No. It can be done a lot faster than 2 weeks. If
like
that's
1 week?
It can be done in 2 days.
In 2 days.
Yeah.
Okay. Well, that's fast.
That's as fast as it gets.
Okay, good. I want to thank you for coming on the program. Very interesting, good stuff. And I think the takeaway for me is, if it costs about the same wherever you go, you might as well go to the guy that has the training, that teaches other doctors to do this.
That's what I like to think so.
Well, good. I want to
Thank you very much.
All right, appreciate it. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.